Hey everyone, how's everybody doing today? I hope you guys are doing okay. I hope you guys are playing a role in lowering the infection that's going on. I hope you guys are staying quarantined and staying indoors. I hope you guys are also staying sane and not going too cuckoo for being indoors for such a long period of time. So today we're going to be talking about GERD, okay? And understand that GERD is basically gastroesophageal reflux disease, right? And it's caused by the backward flow of gastric contents into the esophagus. Now understand that the LES, or the lower esophageal sphincter, is not as effective in the patient with GERD, and the acid breaks down within the esophageal mucosa, okay? One of the hallmarks of GERD is what we call reflux esophagitis, right? And understand that in a patient with GERD, there's a decreased sphincter tone on the LES, and the patient can also develop what we call Barre's epithelium, okay? And Barre's epithelium is quite bad actually, because it causes basically like a thickening and a damage of a lower esophageal part of the esophagus, and it's basically due to the repeated exposure of the stomach acid in the patient, okay? And a big thing to know for this is that it's important because it's associated with the increase of numbers of patients with GERD having cancer, okay, esophageal cancer, and stomach cancer. So we do need to be mindful about that, okay? Now, assessing our patient could have dysphagia. The patient could also have adenophagia, which is basically just painful swallowing. The patient could also have dyspepsia, which is heartburn. Also hypersalivation, or what we call water brush, right? And some regurgitation, okay? Now, let's go on with diagnostics, right? Now, usually with diagnostics, what we can do is we can do a 24-hour ambulatory pH monitoring, which is basically what we do is we place a small catheter via the nose in our patient that goes directly into the distal esophagus, okay? And from there, we're going to monitor the patient. We're going to assess the patient, and we're also going to check the acidity of the esophagus gastric contents, okay? Now, we're also going to be doing, obviously, some EGD or some endoscopy in our patient, okay? Now, let's talk about any surgical interventions for this patient. Now, we have what we call a laparoscopic Nissen funcoplication, and with this surgical procedure, basically as it's stated, it is a laparoscopic surgery, and it's basically done to restore the function of the lower esophagus in the stomach by wrapping the stomach around the esophagus, okay? And it is somewhat of an invasive surgery, okay? Now, understand that we do need to educate the patient that after this surgery, post-surgery, they could have some dysphagia and some increased bloating and also increased flatulence, okay? So we do need to make sure we educate our patient in regards to that. Now, let's go over treatment, okay? So we can do diet therapy to our patients. So basically, we educate them and tell them that they do need to limit or eliminate foods that can help decrease the LES pressure. And some of these food groups can include chocolate, some very fatty foods, and some acidic foods, right? And we do need to tell them that if they can, to spread it around 4 to 6 meals a day, okay? And when they do need to go to bed, educate them that they do need to elevate the head of the bed at least between 8 to 12 inches, okay? Now, let's go over drug therapy. Now, with drug therapy, there's a few categories of drugs that we can give to our patients, okay? One of the main ones that you will most likely encounter in your NCLEX exam are the PPIs, or what we call the proton pump inhibitors. And they're somewhat pretty effective in reducing gastric secretion, okay, in a patient with GERD. And 3 of the most common drugs that you might encounter in this PPI group includes Prilosec, which is omeprazole, Prevacid, which is lansoprazole, and Nexium, which is esomeprazole. Okay? Now, a really big thing to remember is that with Nexium, make sure that we remind our patient to not mix this medication with digoxin, okay? Because that can have some very, very bad effects. Now, another group of medication are antacids, okay? And basically antacids help elevate the pH level and deactivate pepsin, right? And a couple of the most common antacid drugs that you most likely will encounter in NCLEX exam includes Maalox and Mylanta, okay? Now, you do need to educate the patient and tell them that they need to take these antacids at least an hour before having a meal, okay? Now, lastly, we're going to talk about histamine receptor agonists. And there's two medications that you will most likely encounter in your NCLEX exam that are in the category of histamine receptor agonist, and that's Tagamet, which is cimetidine, and Zantac, which is ranitidine. Now, Zantac is very popular. I'm pretty sure you probably have used Zantac at some point. Now, make sure that with patients taking Zantac, make sure that they are taking this medication with meals, and basically helps with the reduction of gastric acid and the gastric acid secretion in a patient with GERD. Okay. Now, this is it for now, guys. I just wanted to do a quick review with GERD, and in the next few videos, I will go over more diseases that you will most likely encounter in NCLEX exam. Sorry, I got a little bit lost. I lost a little bit of my concentration. But yeah, so I will be going over several very important diseases the next few videos. For now, we're just gonna keep it short and sweet. So thank you guys. I really appreciate you guys taking your time to watch and listen some of my reviews. I know it's been a while. Thank you so much. I hope you guys are doing well. I hope you guys are doing safe. Your families are safe. I hope everybody's doing okay. Thank you so much. I appreciate you guys. Thank you. And God bless. Thank you. Bye-bye. Hey guys. How's everybody doing today? I hope you guys are doing great. I hope your family's doing safe. I hope you guys are playing your role in helping decrease this infection by staying quarantined and staying home, right? And I hope you guys are safe. So in this quick 2 to 3 minute review, we will be going over one of our favorite drugs, beta blockers, right? Now, as we all know, we usually use beta blockers to patients with hypertension in order to reduce the blood pressure, right? And it does this by basically decreasing the heart rate and decreasing the heart contractility. Therefore, basically, this drug decreases myocardial demand. Okay? Now, the most common drugs that you will most likely encounter in your NCLEX exam that are beta blockers are, and they basically have the ending suffix of LOL or olol, right? Would include, obviously, except Lopressor. So would include Lopressor. And then another one would be propranolol, which is Enderol, and Nadolol, which is Corguard, okay? Again, these three drugs are the most common beta blockers that you will most likely encounter in your NCLEX exam. Now, one of the most very important thing that you do need to take note, especially for your NCLEX exam with beta blockers, is when you're giving this to patients with COPD or asthma, right? So you do need to assess your patients and see if they have COPD or asthma, because with beta blockers, what it does is it basically blocks bronchodilation, right, in order to produce bronchoconstriction. And this is very bad with patients with COPD or asthma, right, because bronchoconstriction is already in effect with our patients with COPD or asthma, right? So therefore, you can further compromise their bronchoconstriction, and this can lead to respiratory distress, okay? So you do need to be mindful of this when giving beta blockers. Now, that's it, guys. Like I said, it's just going to be fairly quick, but fairly helpful. I hope you guys are staying safe. I will see you guys in the next few videos. I just want to make this short and sweet. I wish you guys the best. I hope you guys are staying safe. I will see you next time. Take care, and God bless. Thank you so much, guys. See you later. Bye-bye. Hey everyone, how's everybody doing today? I hope your NCLEX reviews are doing okay. I hope you guys are staying quarantined and staying at home. And I hope you guys are safe. On this review, I'm going to do a quick 3-minute review, NCLEX review. So I'm just trying this out. So we'll see if this is going to be a helpful review or just a very silly monkey review. So, excuse me. We're going to go over ALS, okay, which is amyotrophic lateral sclerosis, right, or Lou Gehrig's disease. Now, basically, what this disease does is it impacts the nervous system and weakens the muscles, right, and mainly it affects the neurons or the nerve cells that's responsible for controlling the voluntary muscle movement, right? So again, there's a deterioration of the motor system, and there's a progressive muscle weakness and muscle atrophy in our patient. Okay? So the way we assess our patient, usually there's muscle weakness, cramping, fatigue, there's muscle atrophy, and there could also be dysphagia. Okay? Now, diagnostics. We will be doing what we call an electromyography or EMG. Now, with EMG, basically the doctor inserts a needle electrode, right, through the skin in the patient, and the test evaluates the electrical activity of the muscle when they contract and when they're at rest. Okay? That's electromyography. And the patient can also have what we call a nerve conduction study. And lastly, the physician can also do a muscle biopsy in our patient, okay, to really determine if this is ALS. Now, very important for the NCLEX exam are the treatments. So, treatments can include antispasmodics, mainly baclofen and diazepam. Okay? Those two are very important, guys. Now, as we all know, with baclofen, it acts on the central nervous system, or the CNS, and it helps with the tightness of the muscles and the spasms, right? Therefore, that's the reason why it's called antispasmodics, right? Very similar with diazepam. Now, a third very important one is riluzole. Riluzole. What is riluzole? Riluzole is what we call a glutamate blocker. Now, what it does is it basically blocks the release of a compound, an amino acid in the body called glutamate. Now, glutamate is responsible for destroying the nerve cells with people with ALS, right? Therefore, people with ALS have a high level of glutamate, okay? And the main thing that we need to be mindful about when we're giving our patient riluzole is the side effect of hepatotoxicity. Now, it's actually hepatotoxic when it's mixed with other medications, right? Therefore, it causes it can be severe, or it can be somewhat a less severe damage in the liver. Okay, so that's it for now, guys. Let me know if this helped you, or if it was just a silly review. So we just fairly quickly went over ALS, and we're now approaching about 4 minutes. So basically this is about a give and take, a 4.5 minute review. So again, thank you guys very much for watching and listening, and I hope your NCLEX reviews are doing okay. I hope you guys and your family are doing great. I hope you guys are safe and staying quarantined, staying in your house. And I will talk to you guys again soon, and I wish you guys the best. Thank you so much. Take care. Be safe. And God bless. Thank you. Bye-bye.